Welcome to another episode of What is Hashimoto's with Dr. Martin Rutherford. To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com. And now, here's Dr. Rutherford.
So today we'll talk about Hashimoto's versus Graves' disease. And although they seem to be two cataclysmically different conditions, they're not. In fact, they have a bit of overlap. So autoimmunity is involved in both of them. So both of them are autoimmune problems. Both of them are as a result of the immune system attacking an aspect of their thyroid physiology, but in Hashimoto's it's one aspect, and in Graves' it's another aspect. In Hashimoto's, the thyroid peroxidase enzyme is attacked, and far less frequently the anti-thyroglobulin tissue is attacked. And what that means is there's an enzyme in Hashimoto's that's attacked that actually makes the thyroid hormone. It's called the thyroid peroxidase enzyme, and it takes the iodine and the tyrasine. So in thyroid hormones are the main one that's made, and thyroid is called T4. So it takes the T, which is tyrosine, and that enzyme puts that T together with the 4, which is 4 iodines, and then that makes your T4. And when you have disruption of that, when you have an attack on that enzyme, you will tend to make a lot more thyroid hormone. And when you get an attack on, and as you're doing that, it damages thyroid tissue. So you start making less thyroid tissues. So between you making less thyroid tissue, and for the small group that have anti-thyroglobulin hormones, these are, enzymes being attacked, then those enzymes are actually attacking the tissue of your thyroid, the actual tissue that makes your thyroid. And so between those two things, you can get hypothyroid and the tired and the hair falling out and the constipation and edema around the ankles and dry skin and all these different things from everything slowing down. And then intermittently in Hashimoto's, you're going to get an attack on that enzyme that makes more thyroid hormone, and you're going to get jittery. If you get both of them at the same time, sometimes when you get the anti-thyroglobulin antibody attack, meaning the one that's attacking the actual tissue, sometimes when you get the destruction of that tissue, that destruction alone vomits thyroid hormone out into the bloodstream for a little bit of time, and that causes the heart palpitations and the anxiety and the panic attack. So the uniqueness of Hashimoto's is you get mostly hypothyroid symptoms: the fatigue, the hair falling out, the eyebrows going away, the skin going away, the overweight, the constipation, all that. And then intermittently, you're going to get hyperthyroid. You're usually going to be overweight if you have Hashimoto's thyroiditis. There is a small percentage of Hashimoto's patients that actually are thin and have more of the symptoms of what we're about to talk about with Graves. They have more hyperactive symptoms, and so they share that characteristic with Graves' disease, although they're two distinctly different diseases. So Hashimoto's, hypothyroid, intermittent attacks that cause jitteriness. Now we have Graves' disease. Graves' disease is a much more serious condition. It's not that Hashimoto's isn't serious. It's very serious. That's why we talk about it all the time. But Graves is a potential life and death type of a serious. Someone who has Graves' disease is getting a different enzyme attached, the thyroid stimulating hormone that creates, that tells your thyroid to make thyroid hormone, is getting attacked. The thyroid stimulating hormone is getting attacked and it is continually being told to make more thyroid hormone, more thyroid hormone, more thyroid hormone. So it's just like somebody's got their, their foot on the gas pedal, and they just won't take their foot up. It's like they're going 150 miles an hour, all the time, and that's what's going on with that. Now, if you have that happen, now you can also have thyroid peroxidase antibodies be positive for Graves' disease, just for the record. Okay, not that it's hugely important, but you can get those enzymes also attacked there. So now you have those enzymes that are making more thyroid hormone. Now you have the thyroid stimulating hormone that is continually stimulating your thyroid, and now it's just crazy. And so doctors try to dampen it down with different types of drugs. One's called methimazole, and basically it stops you from making thyroid hormone. If that doesn't work, then it's almost always going to be a thyroidectomy of some sort. And in this particular case, I think those thyroidectomies are are a good protocol. Okay, I do treat Graves' patients. Okay, but I do not treat a Graves' patient unless I am co-managing it with a medical doctor. There is a condition called a thyroid storm, and if you get a thyroid storm where that enzyme just keeps getting attacked, like just consistently for hours and hours and hours and hours, you can get, your heart's going to start pounding out of your chest. You can get a heart attack and die. And so Graves is a much more aggressive, much more acute. They're both autoimmune, but different parts of the process of your brain and your pituitary gland telling your thyroid what to do. Different parts of the process are being attacked, and so you get two different animals. That's really pretty much it. Sometimes Graves and Hashimoto's thyroiditis, especially with the thin Hashimoto's patient, are confused, and the testing sometimes isn't as clear. But most of the time, when you do the testing for the thyroid stimulating hormones for the Graves' disease, if that's positive, you have Graves. And so that's the difference between Graves. It's in it. To me, as serious as Hashimoto's is, it's a drastic difference between Hashimoto's and Graves. When a Graves patient walks in here, I'm kind of on my like my little antenna going up, because it's like, okay, do we treat this person, because it's still an autoimmune problem, but that person it's still an autoimmune problem. A lot of times you can still dampen it by doing the same things that you would do to get autoimmunity under control. Find out if food sensitivities, fix their gut, get their blood sugar under control, all those types of things. Because there's different gradients of Graves, as there are different gradients from mild to severe on Hashimoto's and Graves. But I don't care how mild it is. If a person's coming in here, they need to be being co-managed by a medical doctor on that. Because a lot of times the person will be taking the medication and it's not working. Then their next thing is do they want to get a surgery and get it out? And then some people show up in here and go, can we do anything to make sure I don't have a surgery? And then we go into our addressing the immune response for them, and sometimes it works and sometimes it doesn't. And that's why I like to have a good relationship with their medical doctor when we're doing that case. So that's the cliff notes of Graves versus Hashimoto's, but I think that's kind of the guts of what somebody needs to know to understand the difference between the two of them.
Thank you for joining us for another episode of What is Hashimoto's? To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com.